This may look like a hotel room, but it's actually part of a sleep lab. The Neurocare Center in Newton, to be precise. This bed is used to diagnose sleep disorders like sleep apnea, which is when people stop breathing during the night.
Patients have a lack of airflow through nose and mouth. In other words, it stops, or it's very shallow breathing. And each one of these, either shallow breaths or absence of breaths, lasts for 10 seconds or more by definition. Now, patients with sleep apnea may have just a few of those per hour, a few of those episodes, or they may have over 100 per hour.
The National Institute for Health estimates that about 18 million Americans are affected by sleep apnea, and most of those cases are not diagnosed. Some of the warning signs and symptoms of sleep apnea include waking up with headaches, sluggishness, and loud snoring. But it's also been linked to more serious conditions like some heart disease, high blood pressure, and being overweight.
We know now from studies that have been done to this point that in many of those conditions, treatment of sleep apnea reduces the risk for developing those important consequences. And that's extremely important.
To be diagnosed with sleep apnea, patients spend the night in one of these rooms where they are heavily monitored. A camera attached to the ceiling surveys their movement when they sleep. But they also attach to this hub, which records their blood oxygen saturation, breathing pressure through the mouth and nose, as well as their blood pressure and their leg movement. All of that recorded information is automatically charted by a computer.
What we're looking at here are fluctuations in airflow, in other words, breathing that's taking place. And right over here, there's a flat line. There's a flat line here, here, and here. And what this represents, because this lack of breathing is continuing for more than 10 seconds, is that this is an apnea.
Once a patient is diagnosed, one of the most effective treatment devices is called constant positive air pressure, or CPAP.
This is a device called nasal pillows. These are really not pillows, that's a kind of a bad name, but they're these little, very flexible things that go up against the patient's nostrils, as in this model here. And then basically they're straps that hold this in place up against the nostrils so that it's airtight, an airtight connection. And then
it's important for the nasal pillows to create an airtight seal, because otherwise the air coming from this blower wouldn't be able to keep the patient's airways open. Dr. Biber explains that even once diagnosed and outfitted, patients can experience difficulties properly operating their CPAP. In absence of a proper physician, they could find themselves with continuing symptoms due to improper use even after being diagnosed and prescribed treatment. And there are currently not enough board-certified sleep experts to take care of all those with sleep apnea. For BU News Service, I'm Gauthier Giacomoni.